Good morning, dear friends. Myself, Dr. VIPUL GURJAR. I am the head and professor of the surgery in SBK's Medical College, Vadodara, as well as private practicing surgeon in Vadodara. Today is the 7th December and I am enjoying good weather in Gujarat. Mild cold is there. Today we are going to discuss about the basic of laser in part 3. I am going to discuss about the fibers and its use. It is always a basic thing of laser thing and we should understand all this basic thing. Before starting discussion, I want to be clarified that I am sharing this video from my another account because of the anorectal photograph. YouTube has blocked my main channel and given the strike for the 7 days. So now I am not able to upload the more videos from that. I will upload afterward from this all this video to my main channel. This is for the sharing base. I am using my another account. As well as previous this lecture I have uploaded one more video about the practical use of a laser machine as well as about the discussion of laser machine. This is a discussion of laser fiber and later on I will upload the practically how to how looks the laser fibers by visual appearance. Okay. Now, from the laser machines, you will get a three type of fiber. One is the bare fiber, second is the radial fiber, and third is the conical fiber. If you are a anorectal surgeon, then you will use all these fiber frequently. If you are endovascular surgeon, then radial fiber is most important fiber for them. And if you are other than the proctology and the endovascular, you will get a bare fiber. Mostly, it will be useful in your practice. Okay. Now, first we'll see about the conical fiber. These conical fibers are available. In that conical fibers, there will be a glass tip on the conical, as well as in a radial fiber there is a glass tip at the tip of fiber. This how to differentiate between the radial fiber and the conical fiber by visual appearance. Radial fiber tip is rounded one, and while the conical fiber has a some pointed tip on its tip. These two type of fibers are available in with the differently with the different companies. That means sometimes glass is separately attached over the the fibers, while many companies are giving a single wire with the glass tip. So it's depend upon how from where you are purchasing the fibers. Okay. Now this glass tip is very important because of this glass tip the bare fiber is converted to conical and the radial fiber. It means principally the companies are giving the bare fiber only, and if we are attaching the glass of conical, then it becomes a conical fiber. If we are attaching glass of radial fiber, then it known as a radial fiber. What is a radial fiber and what is a bare fiber and what is a conical fiber? We are discussing about first with the conical fiber. Conical fiber is mainly used for the piles surgery, and because it has a some sharp tip, it is useful to puncture the pile mass itself. What is the advantage of this conical fiber? This conical fiber having this glass, and once the laser is emitting machine from the wire, it spread 270-degree. That means the whole pile mass, whatever we need, it involved in a one laser energy emission. Okay. As well as these glass fibers are conical, so whenever you puncture the mucosa, you are able to puncture that mucosa. Okay. As the now the we go with the radial fibers. These radial fibers are mainly used for the cavity obliteration, like the fistula, or pilonidal sinus, because this energy of laser is emitted from the 360 degree, and for the fistula as well as the pilonidal sinus we have to cover the all the cavity in the 360 direction. That's why this radial fiber is useful, but these radial fiber are blunted, so there won't be the puncturing facility in the tissue. So only it will be used for the fistula and the pilonidal sinus. Okay. Uh, Before going to bare fiber, I want to discuss that at the end of this description about these laser fibers, I will give how to maintain and what is the advantage, and how to convert the fibers in a routine practice. Okay. Then we'll switch over to further the bare fiber. This bare fiber is the main useful fibers in our routine practice, because radial and conical fiber glass tip is broken itself after some use, and this bare fiber is now becomes available fibers. What is bare fiber actually? The bare fiber is the fiber which convert the energy from the tissue, but it doesn't have any glass tip or any coverage over the tip. So that's why this energy is concentrated at the one point. Conical fiber, this energy spread in the 260 direction, 270 direction. Radial fiber in a 360 direction, while bare fiber like a battery. Okay, once we operate the battery, the lights comes in a 180 direction only. So this 180 direction it converges in a one point, so the all the energy is concentrated at the one point. That's why the tissue destruction is more, and that's why we are using as a cutting property of laser. But there is a no cutting mode in a laser itself, but because of the higher concentration of energy at given point, they destructs more. That's why it cuts more. While the radial and the conical fibers are known as a cold fiber by me. It's known as a cold fiber because it is spreading the tissue, and that's why it gives a somewhat hemostatic or coagulative property. Okay, but ultimately the all fiber are basically a bare fiber itself. Okay. Now the many people are asking the fiber is cutting or the coagulating. No, the only the bare fiber has a cutting property, not a cutting property, because it is converging at the one place more energy. How to deal with it? If you are remaining more near the tissue with the bare fiber and you are increasing the energy, that means in a piles we are using energy of 6 volt, while we for the cutting we have to use a 10 watt or the 12 watt machine. So it increases the energy, gives a tissue destruction, and our tip must be the near the tissue only. If you are remaining away from the tissue and if you are using the low power machine, then it gives the hemostatic activity. That means it catch the blood vessels and coagulative activity. So how to use as a coagulation? Just remain 3 to 5 millimeter away from the target, you will get a coagulative effect. If you want to go for the cutting, you have to go reach near to the tissue. According to the principle, all fibers are of a single use. So if you are affording the fresh fire, you must use fresh wire for each case, but practically we are not able to do that thing. That's why after the all the ETO sterilization we are using the wire further. According to me, we are dealing with the anorectal surgery as well as we are dealing with the closed cavity, so we have to use only sterile fiber. This is the now a century of sterilization. We are not using a single needle further, then why we should use a used fiber? We have to clean, we have to sterile with the ETO only. Autoclave is not possible in the wire. Okay, so ETO sterilization, it cost is very less and very minimum, so I recommended you to use a sterile wire only. Okay, how to maintain the radial and the conical fiber? Okay, see, after the 10 to 15 to 20 surgery, this glass tip, because of the energy it protect, or it is thing which is coming in between the energy. That's why the glass tip becomes broken. It may burst during the surgery or later on also. How to deal this thing? See, after bursting the radial or the conical fiber, it becomes only the bare fiber only. Okay, now it doesn't have a property to spread the 270 degree, and you cannot use as a normal conical fiber the pile surgeon. Now it becomes a bare fiber only. And even the same thing, radial fiber, after busting of the tip, it becomes only bare fiber property. If you want to do the fistula surgery, you must buy a new radial fiber. There is no alternative at all for the piloidal sinus and for the fistula surgery. Yes, for the bare fiber you can use in a pile mass very efficiently. Sometimes these glass fibers, the glass tip of radial and conical fibers are detachable. After using one or two use, it may detach itself. So what I am doing, after one or two use, it becomes loose. I will apply some Fevikwik over the fiber, this bare fiber, and I am fixing the glass tip. So I can this long use for the long period. But it is possible when the detachable tip is available. When there is a single fiber, it is not possible at all. Now, how to differentiate between the radial fiber, conical fiber and the bare fiber? One is its glass tip, as well as radial fiber and the conical fiber have a marking on the this wire, or this white wire. Actually, all the wire, the glass fiber or the this fiber are coated with the sheath. Okay, this is a somewhat a plastic sheet. That means like our simple electric wire, inside that copper there will be a sheath. Okay, this copper, it means it is a fiber, glass fiber, while the sheath, it is only the covering. Okay, this sheath having a multiple marking for the 5 centimeter in marking, so we can know about the fistula length and we can give energy according to that thing. Okay, that's why this radial fiber and the conical fiber having a marking over the sheath. Okay, now about the bare fiber further. Bare fiber are available with the same thing. There is a glass inside as well as there is a sheath outerward. Okay, so every time for the exposing the tip, we have to remove the outer sheath from the bare fiber. Okay, the ideally for the pile mass surgery, 3 millimeter tip is advisable, because if a larger exposed tip, there will be a chances of breakage in the tissue. That's why only 2 to 3 millimeter outer sheath we have to remove. For the bare fiber, after removing this sheath, it is very easy. If you can use a simple knife to just touch the sheath, and you can remove that sheath easily. it is loosely attached, but the bare fiber having a some invisible covering over that, you have to remove that covering also. For the bare fiber, I am asking you bifiber. Normally these bare fiber sheaths are the plain white color sheath. The bare fiber is another use of bare fiber is to in a diabetic foot ulcer. The diabetic foot ulcer having a different type of handpiece in which the only the bare fiber will go inside, and there will be a separate lectures on the diabetic foot with the laser later on. So I am not going that much detail, but this bare fiber is useful for the diabetic foot ulcer treatment. Okay, and now be careful. After this bare fiber, every time once you are using this in a pile mass or everywhere, this there will be a carbonization over the tip, and because of this carbonization, the tip becomes a so much fragile one. So after every puncture, you have to check the tip. Sometimes it may breaken inside the tissue, and you may be worried how what to do. So it is better to check the tip every time. Okay, after the use of surgery, like you have done the 3 pile mass surgery, and there will be the intake tip. What to do? Eat this tip with the fresh sheath. You have to trim, you have to cut about 2 to 3 millimeter in size. Otherwise you will get a damaged tip in a next surgery. So after the surgery, you have to trim and you have to expose the glass fiber from the inner side. Then you do the ETO cleaning and then the ETO. Okay, now this is about the bare fiber which is available. But what happens once the radial and the conical fiber glass tip is burst and it becomes a bare fibers? This is a bare fiber, but it is somewhat different from the available bare fiber. Why? Because in a radial and the conical fiber, the sheet, outer sheet is snugly fitted to the glass fiber. It is not easily exposed like our routine bare fiber. In a routine bare fiber, you just apply the some force of knife, it will come out easily. While it is soluted in a radial and the conical fiber, it is soluted. So it is not easily removed. There will be a cutter is available by with many company. So you have to apply the tip, cut the tip, then there is another slot in which 2 to 3 millimeter there is some marking is available. You have to apply that marking, you have to apply that snugly bare fiber and pull. So the outer sheet will be removed and the inner glass tip will be exposed. Okay, many person doesn't have that trimmer, or companies are not providing that trimmer. Then how to expose this bare fiber for a burst tip, radial and conical? Mind well, I am not giving this clue for the available bare fiber, but once it is bursted tip, the bare fiber, how to work that I am showing you. That now you have cut it, there is a no exposed glass fiber, but for use we have to do the exposed glass fiber. Then how to expose? One is by the trimmer. If it is not available, with the knife you can do, but it is somewhat difficult, it may injure the glass. So you can take a ice cream wooden or a simple wooden and apply the tip and start the laser for 3 to 4 seconds only, and you can see there is a exposed glass fiber. So after this glass fiber and the remove excess the sheet, otherwise it will not you are not able to pull from the handpiece only. Now how to clean the tip? how to clean the tip. The hydrogen peroxide, it is a best solution to clean the tip after every use, because there will be a carbonization over the tip. As well as if you have a intake conical and the radial fiber glass tip, then do not do the cleaning like this. You have to do cleaning like this, otherwise this glass fiber tip will come out easily. So hydrogen peroxide cleaning, betadine cleaning, whatever the cleaning, do remove all the carbonization, and for the bare fiber you trim. Otherwise, whenever there is a glass tip, there is no need of trimming. We have to reuse with the ETO sterilization. After the using of this glass, you have to keep in a circular larger box to roll, because there is a inside the glass fiber. If it is broken inside, the laser energy will not traverse. Okay, so you do not use like a cautery wire. It is a glass inside. You have to roll with the very in a easy way, and somewhat you are working with the glass only. Okay. So you can say, is it costly? No. After the every trimming, you will get only the expense of 200 to 300 per surgery. It is better to trim, and it will be benefited to the patient only. So trimming is must after every use. For this to prevent the bending, there will be a one stand is also available in a machine. You have to apply the stand, and then you use a wire to prevent the bending in the glass fiber. And this is all about the basic thing of laser fiber. We will discuss how to load in the handpiece, and what are the different parts of handpiece, because the handpiece is also a very important role. If you are not knowing that, then you will may damage your fiber, or you may damage the tissue also. So we will discuss about the handpiece in our next lectures. If you have any queries, please give me the message. I try to solve this all the laser problems step by step. Thank you very much. Bye.